Ankit Patel, welcome back.
Hey Steve, thanks for having me back.
Yeah, always great to have you back. Definitely a repeat guest. And today we're going to talk about scalability. I think that's going to be the key word for today's conversation. When we look at a lot of owners feeling probably constrained to a large degree by staffing issues, by turnover. There's a lot of understaffed practices, a lot of
Yep.
overworked, burned out teams out there. And what is that causing? It's causing a lot of owners to feel forced to take on more of the workload than they're accustomed to. And we were talking about this earlier. There's a hidden cost to that. If you're thinking about selling in the near future, the practice, if a practice is dependent on the owner to make it run, it's naturally going to become less attractive to a buyer. I think a lot of buyers these days don't just want to buy another job. They want to buy an asset. They want to buy a lifestyle. So I'm really looking for this conversation. And what I'd like to do is connect the dots today between scalability, and we're going to get into an area that you're very familiar with and you have a lot of experience with, remote teams and AI, and that connection between scalability and a creating a more, let's call it, buyer ready practice. So let's start
Mm.
by defining scalability. I That's a word that
Yeah.
gets thrown around a lot in business, but what does that actually mean for an optometry practice?
Yeah. And so there's a lot of ways to define scale. And for today's discussion, the way I'm going to define it is the ability to grow without hitting a complexity ceiling. And what that means is that you might find that, hey, we can grow the business, but the more we grow, the more people we have, the more problems manifest. Scalability is the problems don't compound as you get bigger and you get more volume. That's how we're going to define it. And it's going to mean something different for people in different parts of that cycle. If you have five locations, that means something very different than if you're just starting off or year one or two or three, right? And you're the primary doctor. And so the biggest thing is if I go to my next step, if I increase by so scale isn't necessarily like 5 or 10% growth, right? Scale is like, okay, what if I were to double the business? Would I still have the same problems? If I would my problems increase? And so being scalable means that you solve those problems where you don't introduce new problems and your current problems tend to not scale as your business goes. So hopefully that helps kind of frame what we want to talk about today.
Yeah, it's largely contingent on simplification, which I think every business owner out there is interested in is how can
Yeah.
I operate this more efficiently? How can I make this easier to run? I'm curious about your own practice because I know that you've been somewhat of an innovator in remote teams. You've actually built a business around that. We'll get into that a little
Yep.
bit throughout the discussion. AI has been uh, you've implemented that to a high degree within your practice. But I'm curious, your practice from, let's go back even maybe just 2 years ago,
Yeah.
3 years ago. What's visibly different in the day-to-day operations, and what are you no longer doing?
Yeah. So one thing that we found was is the biggest challenge that we found was that our staff was having trouble in deciding between do I answer the ringing phone that's ringing off the hook or do I talk to the patient in front of me? Right. And that was a tough decision. Obviously, we said to deal with the patient in front of you, but it's kind of annoying having the phone ring in the background. The patients hear it, and so that was an issue. And I was like, well, if we keep growing, that's just going to be a compounded problem. So why don't we just take that and put it outside the office? And so we ended up with like a remote hybrid team of people from on site and also people remote staff from around the world. So we call it global resources. So as we started refining that, we found that our our on-site team was more valuable in front of patients. And so when we looked at it from a scale problem, we found that hey, our phones are really distracting to our team because there's a lot of admin burden, along with things like verification of insurances, confirming, maybe some filing and billing, some basic admin things were just distracting. So we wanted to remove and strip that away and really just focus in on if you're in the office, you focus on the patients that are there and give the patients a really world-class experience. And so that was started our journey way back when we realized that, hey, we couldn't really just scale this business if we had all this admin tasks. So we wanted to offload those admin tasks so we could have the patients flow through our process. So we want to do things like, hey, we want zero perceived wait time for the patients at any given point in the journey. So what does that mean, right? So if they're walking in, we want them to go straight back to tech, and or we want them to go to optical if the tech is busy. We actually don't have a front desk position anymore officially. It's either tech or optician is the position, and they're cross trained. And so when the patient comes in, depending on who's there, they take them either to the optical or they take them to the tech room, and then we start the process there. So those are some things that we simplified, for example, as we started to scale our business. And we were able to do that because we have our global team that can help us with things like the phone and admin task. Now, I will say this, like, is it possible to do that in office? Yes, but the costs were pretty high. And so that was a decision we also had to make was where's the trade-off for cost and finding the right people to do these tasks and managing them versus, going outside our four walls.
We've heard numbers around staffing that have gone up over the last several years, but we always used to say, as a metric for staffing, it tended to be in the low 20% of your entire collected revenue, and that sort of 20 to 24. Has that gone up?
Mhm.
Yeah, it's gone up. It's not unusual, 26, 27%. What could it be with the remote team? And I know that's a broad question, but if practices are looking at utilizing more of a remote staff, it changes the calculation there. It reframes the budgetary discussion around staffing. What could it be with the remote team?
I I know that I can tell you what we do. We do between 22 and 24% any given quarter, and an average about 23 through the year, based off of bonuses and things like that we give out. And so we've been there consistently, and we actually will make pay raises to make sure we're in that frame because we find we get good talent when we adjust accordingly. And so that's what works for us. Now we could be lower if we wanted to be honest, but we don't because we want stable staff. That's important to us, and we want to pay them well and above market wage. And by the way, we weren't able to do that until we had our global team helping us with some of the admin tasks. We went from a staff of about 14 down to six, right? We're doing higher volume and higher numbers now with less people in office because we were able to do that and streamline that. And so, like you mentioned, scalability is about reducing the complexity. So, and we were at the stage we had multiple offices, we were growing, right? And so we were at a different stage. If we were at a if we were growing at a if we were smaller and growing, that looked a little different for us. When we were starting off, what scale looked like was, hey, we need to know all the details about every single thing that we were doing, right? We had to have our hands in it. Everything had to be almost perfect because we didn't have the volume. So every experience had to be really good so we could grow. But we noticed that, okay, at a certain point, we had to make decisions to make it easier to scale. So we couldn't say I think this is very common. I'm going to have this particular patient with this particular procedure be 15 minutes. Well, the same exact type of procedure, but a different patient who might be older, they're going to be 45 minutes. Right. And so doing that becomes really difficult when you start having all these little rules and nuances. Stuff like that is okay when you're starting off and you may be seeing like 8 patients a day or 10 patients a day. But when you start getting 20, 30 plus patients, that becomes very hard to manage and really almost impossible to scale at a really high level. And so those are some things to consider as you look at this is how do you simplify the model?
It's back to complexity again, right? Reducing the complexity. I'm curious on, you mentioned the 22 to 23%
Yep.
for your payroll. Does that include the remote team as well, or is that just your internal team?
That's everyone.
That's everyone good. So that's
Mhm.
on the low end, which is what a lot of offices strive for. I'm curious too about the indirect benefits. So you've removed the complexity, you've got fewer people in the office with, I think, the ultimate goal, more ability to focus on the patient. How has that shown up in your practice?
Yeah, well, I think our tagline is we reduce costs. Well, we actually reduced it more than this, but we kind of under promise, over deliver. But we reduced them by over 20% and increased our revenues by 33%. The revenue increase was surprising because what ended up happening was this is the other equation of the scale is you can raise your floor on what's expected from in-office staff when you take away the noise. So admin work, phones, all this other stuff. What we found was their staff tended to be very much, and they were like, oh, I got to do this, I got to do this, I had to do all this other stuff. I couldn't focus on the patient. When we removed all those things, it became very clear, hey, this is all you're focused on. We took all the stuff off your plate. quite frankly, we had to make some changes because some people weren't able to bridge the gap and develop. And so we found people that were, and it helped increase our numbers because we made it a better experience. Patients were understanding the value of why they should buy from us. We were spending a little more time and able to talk through, hey, this is why the IPL is good, or this is why these glasses are good, or whatever it might be for that patient. And so that ended up making it better financially for us as well. So it was an unexpected benefit that we were able to actually have better in-office staff as well.
I was speaking with another OD who was just starting to implement remote staff into his office, and I asked him how he handled the issue of staff feeling maybe threatened that their job was going to go away. And he took that exact approach when he went to them. He said, "What could I take off your plate? How can I make things easier for you? I don't want to replace you, but what are the things that I could take off your plate that allows you to focus more on one, the things you like to do, the things you're good at, and the patient?" And that all has been driving growth throughout the process.
Yeah.
Um, Before we jumped on, you mentioned something, and I'm going to ask you to expand on it here, that you've transitioned or pivoted from what we a lot of people know as virtual assistants to more of a done for you approach. And maybe that takes us more into the
Yeah.
business side of things, or maybe there's some crossover with your own practice. But can I ask you to expand on that?
Yeah, so we're talking a lot about scale, and really, look, it's not scalable unless it actually makes the numbers actually work. And so what we've noticed with a lot of our clients in the past and ourselves, if we just had a quote unquote virtual assistant, which there, by the way, there's a ton of companies out there that do this now. It's like a commoditized way of doing it. But the virtual assistant model, the way it typically works, so for your audience that doesn't know, is the companies are the middle people. They basically will find you a person, and everyone does it a little bit differently, but they vet, you get a placement, and then your job is to manage it, organize it, give them the technology, make sure they're in compliance, make sure that they're also doing their job and making sure they're delivering to what they're supposed to be doing. And by the way, if they're out, they're just like any other employee. You've got to deal with their work. Someone else has to deal with their work if they're out. And what we found was that many times that people would bring on these folks, they wouldn't necessarily change anything else in their offices, right? So it was just extra cost and it wasn't actually benefiting at all. And there wasn't necessarily a productivity improvement either because there wasn't that focus on, hey, we need to focus on certain deliverables that have to happen. And so it can be a nice to have, and it might be a nice lifestyle for folks in terms of like, okay, this maybe feels like it takes some burden off, but our average for patient capture rate's not going up. Our training for our staff, we're not doing more training. Yeah, and they're basically we're not seeing an improvement. We're not seeing a financial benefit from this, which is pretty common, especially if you don't have good management infrastructure. Because managing a remote team is very different than an in-person team. Like it's much more. People call it micromanaging, but you almost have to at some level, just because there's trust has to be built differently with a remote team. And it's not the same. You can't see someone. You're not saying, "How was your morning? How are your kids?" Right? You're not saying like, "Oh, how's that? Let's go get coffee together." That's not there. All these little nuances that when you're in person go away. That's why there's a big return to office initiative with a lot of companies because it at scale it does make a difference with culture. Now, it makes more of a difference with people whose job is more around is a little more undefined. But I think for the healthcare practice, it makes a difference because it's very relationship based, right? I know optometry offices are very relationship based. We shifted away from that into a done for you model. And so what we said was like, where are the critical pain points? So front desk is a real critical pain point that people spend the least amount of time and resources on, but it's probably the most critical piece, especially for a new patient coming into your office. So we have a remote hospitality center is what we call it now. And what that is that, and this is, by the way, from lessons learned from our own offices as well as from our clients. And we said, you know what? Let's take this off the plate for doctors. Basically, instead of having a body that they manage, why don't we support them and be a part of their team and really help them grow and be competitive? Because we have a lot of good insights and knowledge, and we know how we should structure it, and we know what it'll take to actually be able to get them to scale. So the remote hospitality center, instead of just saying, "Hey, here's a person, you go figure it out," well, we figured out the technology piece because there are some technology issues with remote teams that I won't get into this conversation, but there's a lot of technical details, whether they're doing phones or anything that you have to figure out. We figured those out. We'll do inbound calls, we'll do recalls as well. We'll also make sure to confirm appointments and do verification of insurances, along with training backups. So if someone's out, there's a backup there. So you're always seeing people. We'll also make sure to monitor. We have a dashboard that's included because we need to see that visibility. We want to know how many people are calling to make appointments, how many of those got converted to appointments, right? Most systems don't have that. We've built that into that as well. So everything we've built has been because we wanted it at our offices. And so it's really helping other folks to get to that scalability. Because you have to know these things if you want to be able to scale. You've got to know, like, hey, how am I doing on the phone? Right. It's hard to see that. I know we didn't have that before we built something internally for ourselves. And so there's a manager, there's someone that actually goes in and tracks your appointments, saying how did you do this year versus last year? Do we need to do more recalls or outreach? Are we actually filling the books? Because that's really the important thing here. Are you actually hitting a business objective? Because you can have extra bodies, but are they actually generating results is what you're looking for with this. And VAs typically, if you don't know how to manage them properly, won't necessarily fall into that bucket. So that's why we created that remote hospitality center to really have a focused problem solution set.
I just did an episode where I interviewed Dr. David Kading, who wrote a excellent book on the topic called The Invisible Team.
Mhm.
And that's one of the things that he was talking about was our motives for hiring remote staff. And he said, if you're just doing it to save money, you're doing it wrong. You're going to lose. And what I think he discovered, because we talked a lot of things that have worked for him, and just like you said, you learn from it. You learn what doesn't work is the amount of work that still goes into it. I think when we first heard this term virtual assistant, we thought, great, I can hire somebody at a fraction of the cost and all my problems are solved. But what we didn't think through was the need to have systems in place, that we needed to train them, that we needed to track their productivity, there needed to be accountability, and all these steps that were there. And you highlighted one of the most critical and undervalued positions in a practice. And I'm going to reference a study of over 2 million people. So no small sample size. And they asked them, what are the top qualities that you look for that drives patient satisfaction with doctors? And the number one probably won't surprise a lot of people. The number two will. The number one was doctor communication, which is no real surprise, right? Our ability to communicate well with staff. It drives outcomes, it drives patient satisfaction. That was number one. Number two, the helpfulness of the receptionist, the arguably least trained, lowest paid position in the
Yep.
practice. So, as you mentioned, you don't have a receptionist in the office. That revolving door of receptionists that come and go so quickly, where I think we kind of neglect that position, but you've outsourced that position, or in your case, you have that as part of your remote team.
Yeah, and I don't like the word outsourcing because it kind of implies the grenade over the wall, right?
Hmm.
They're still critical team members, right? They're integrated team members. So we call it global resourcing. They're just not in our four walls. So the phones are taken care of by our global team, and our in-office experience is controlled by our in-office team. And so we've kind of got a little bit of like I said, techs and opticians can both check in, but we know that there's a certain level of expectation and experience that we want them to have when they walk in the door. And so now, guess what? If we don't have that position, we can allocate more resources and dollars to techs and opticians. We can find people that are more there for longer, can learn, and usually are better quality folks as well in terms of like the working quality. Um, and I also want to hit on the piece that you mentioned that with the front desk, like phones, I think the national, not everyone, but the national average is $20 an hour. And that's not fully loaded, right? So fully loaded with benefits and everything is more. Um, and that's the national average, right? And so when we look at that and people are like, well, I don't know if I want to pay that or not. And when people have that as a first experience, they'll be like, okay, hey, this is good or bad. And they'll make decisions if they're new patients whether to come or not. So we find two things. If it's a bad experience or they get a voicemail, new patients, 90% of them won't call back. And so that led us to also do a AI voice bot that's optional for our clients that we use. And we use it, technology should serve humans, not the other way around. Right. So the technology, we find that people still want humans. So, most of the calls are answered by human, but there are times we get more than average calls. And what happens there is that the AI takes over and makes it feel like, okay, I've got my needs taken care of. There's still a human in the loop, but that has a psychological effect to say, oh, they still got me. I don't have to call the next person. I have an exam here. And so we find that that helps a lot with helping with patients and making appointments. Because again, that's part of what scalability means. You can't lose those opportunities. And so with a virtual assistant, that's just you'd have to figure that out internally. We've kind of the done for you solution, the remote hospitality center, providers like what we do, that's the differentiator there. We'll look at, okay, what can we introduce from a technology perspective to actually make this better? So AI is one of them, our dashboard's another one with the insights, and we're continuously looking at ways to improve that.
Well, speaking of opportunities, there's a number out there. I just can't remember a percentage of calls that don't get answered in
Yeah.
optometry practices. It's not flattering. It's not flattering. And it sends a bad impression. I'll tell you, last night, my wife and I were ordering food, and I called the restaurant to place an order, and nobody picked up. And
Mm,
it just immediately leaves kind of a bad first impression. Like you don't have someone there to pick up the phone. I want to give you money. I want to do business
yeah.
with you, and you can't pick the phone up, right? It leaves kind of a bad first impression.
Well, I can tell you that it's usually correlated with the amount of volume. And if the company, if the optometry practice or practices have not given actual thought on how they're structuring the phones, the more they have, the more they miss is the rule of thumb. And so most of the time we see anywhere from the best office I've ever seen was 95%. And they had like a whole process to manage it. And they had like a whole team looking at that. Um, Normally what we see larger practices tend to be around 50 to 60% missed calls. Smaller offices are usually 20% to 30% missed calls, usually, sometimes as high as 40. So it really just depends on how much effort is put into it, how much volume you have. But that's an example of scalable problem. When you're smaller, you don't really think about it, right? Like, okay, we missed, we only had 7 calls come in today. You miss one, not a big deal. You call them back. Well, or you have 10 calls come in, you miss one, not a big deal. Well, now you get 100 calls a day, you miss 10 to 20, and you miss more because they don't come in equally. They come in spurts. So when you get a lot of calls, you're going to miss a lot of calls. And so you didn't change your staffing model to account for that. And now you're missing, not necessarily missing 10% of your calls, you're missing 20 or 30% because all those calls are being bunched up. And so little nuances like that and understanding scale are things that we don't really think about. But it's interesting because as you scale, the problems scale too, meaning that it's not just like, oh, we're going to miss 10% of our calls when we're twice our size. No, you're probably going to miss 20 to 30% because the problems get bigger as well as when you get bigger as well.
Yeah, I think that's the number I heard was around 40% as an average, which is really extraordinary considering
Yeah.
the amount of effort and energy you put into getting people to call, right? Your marketing, your
Yep.
efforts, your customer service. You want people to see you, you want to be visible, you want the word of mouth, and then somebody picks up the phone to call and then nobody's there to answer. Really, the definition of dropping the ball. I'd like to pivot to something we alluded to at the beginning of practice valuation. So, as we look at the modern buyer of a practice, and I said this from the start, I think you got a lot of people now that don't want to buy a job, right? They want to buy
Yep.
an asset, they want to buy a lifestyle, they want to buy a future where they're not at the center of everything. So, and we've often used this as a watch out for doctors that are selling their practice, where if everything revolves around you, the owner, that's potentially going to be less attractive to a buyer. So I'm curious how all this circles back to and affects evaluation. When remote teams are implemented well, you've talked about some of the things that improve, but can you give some more color and insight to how
Mhm.
that appears from a buyer's perspective?
Yeah. So, we've actually had few clients actually bring us on board to improve their profit margin to help look more attractive for sellers, and they sell, right? And so that's a very common reason people bring us on board as well. Now, one of the things I'll say is like, so let's talk a little bit about if people don't understand what people actually look for in business buying. People are, like you said, they're not buying a lifestyle, right? If people want a business, what they're looking at is a performing asset. If you're so there's kind of a couple different buyers. There's a doctor buyer who's looking at it from a lifestyle. I want a career, but I want to have freedom, right? They're going to look for different things than someone who is like, hey, we need a performing asset that I'm not going to be able to run it because I'm not a doctor, but I need to be able to have a performing asset that can replace a doctor and it runs, and I think I can grow it from here. And so what you want to look for there is what they look for. Typically, there's different ways to do it, but most of the time is a metric called EBITDA, earnings before taxes, interest, amortization, and depreciation. Long story short, it's the easiest way to think about it is profit margin. We're not going to get into details about exactly how that's calculated because it's a little bit different than our profit margin, but you get some sort of multiple of that. And so if your cost, for instance, let's say we'll just use profit margin instead of EBITDA for the sake of simplicity. Let's say it's 10, let's say for the math's sake, it's 10%, right? Well, guess what? Out of that 10%, um, you have your cost for a non-doctor payroll, let's say it's 30% when it could be 25%, right? And so that's roughly 5% margin right there. So you could easily go from 10% to 15%. And that piece right there moves you from maybe getting what they call a multiple. Maybe like let's say the multiple is the same. So someone will pay you like 3 times your profit. So, you're making $100,000, they'll pay you $300,000 for the business. Now you go from $100,000 to 150,000, and they're just paying 3x. Now that moves to 450,000 versus 300,000. So just by moving that margin of profit, you get more on the sales side. And it's also much more of a scalable business, right? So when it's a done for you solution, it's like, okay, I don't have to worry about people transitioning out because this team is consistent, they're stable. They're not going to worry about a new ownership, right? And so those are things that are also important that the buyers will look at because they want something that's easy. They don't want hard. And so I think that gets lost in the sales side. So if you have one location or multiple locations, these are all the same thing that buyers will look for.
And Ankit, I want to close out with a bit of a futuristic question. I'm going to ask you to look into your crystal ball here. We've seen tremendous change over the last couple of years, but I think we're just in the infancy stage. And two things that are driving a lot of these changes are AI and more of a global workforce that we're seeing. But again, I think we're in the very early stages of this. What does the practice of the future look like? And when we used to ask questions like that, the assumption was we're talking about 20 years from now. What does the practice of the future look like in 3 years?
That is a great question. I don't know. So this is a field that I feel like I have some pulse on, but it's really hard to say. Um, So here are some things that are possible based off of a guess, but keep this in mind that it's not my area of expertise. So this is just pure speculation and brainstorming. Um, there is AI obviously is coming and it's coming fast for productivity. I would imagine the remote exams are going to get more popular, especially in rural areas. It's going to be easier to administer remote care. So I do see, for instance, private practice in remote areas having things like OCTs that have AI that automatically route to ophthalmologists or optometrists, depending on your state, for care for people who have flags. But AI does that automatically, so the internal medicine doctor doesn't have to do anything. I think that's definitely coming down I know that's coming down the pipeline for sure because I've talked to equipment reps. And in addition to that, from our perspective, technology is going to be constantly changing. So there's going to be improvements somewhere. I don't know how the market's going to receive everything right now. For instance, the AI bots, people are kind of resistant to it. And I equate it to self-checkout or at fast food restaurants, the self-checkout there. It's not the same experience as having a person. Sometimes it's okay, sometimes it's not. I think it's going to be dependent on your practice, what people want. If you're of high volume, maybe government plans or VA, where it's more about volume than it is about care, like a fast food restaurant, maybe that's okay. AI might be more prevalent there. If you're more boutique and create a unique experience, people may want that experience with a human. That's what my guess would be where things are going. But there will still be on the back end automation. There'll still be efficiencies gained. Reimbursements probably aren't going to go up that much, to be honest. And so I think that practice scope, we'll start seeing doctors practice more at the full scope, and using some technology and using things like AI to help kind of facilitate that, meaning that it'll make it easier for them to do things, easier to manage complexity, whether it's admin complexity or it's medical complexity. I think we're going to see more of that over the next 3 years. Now, healthcare is slower to move, so we're going to see signs in other industries first. So what I would say is look at what the other industries are doing, from technology, transportation, hospitality specifically. See what's happening there, and those might be trends that are coming to our industry in the next few years after it's implemented there.
Great feedback. And I think it's important from as we look to the changes and what we want to adopt maybe some things we want to push back against is running through the filter of how does this improve the patient experience? Because I think adopting technology just for the sake of technology or adopting, let's say, remote staff just for cost savings, you're missing the bigger question. And I find it interesting and encouraging when I look at data on what patients actually want. So patients are not opposed to AI. In fact, they're all for it if it improves the patient care and if it improves the diagnosis. But what they still want is a human being. Is there a segment of society that is going to think it's really cool that they can get an exam through a kiosk? Sure. Is that going to grow? Probably. Are there patient's going to be first in line when the doctor walks in the room and starts flipping dials? There's always going to be a segment of that, but the overwhelming majority of patients, when surveyed, not only want a human being, but they're actually worried that AI is going to interfere with the connections that they have with their doctor. They don't want that much technology involvement in their lives. They still want to be able to go in. So I think we're safe from that standpoint. But I think doctors that fear it, it's okay. But like somebody told me once, you don't have to like trends, just don't ignore them.
Yeah.
Don't ignore this one because it's coming regardless. And there's a lot of benefits to it. I think there's things that there's watch outs, there's things that maybe our profession needs to push back against. But the amount of benefits, efficiency, increased productivity ran through the filter of how does this improve things through the patient, I think it's something worth exploring.
Yeah, I think so too. And the nice thing is that there's a lot of good peer networks. Like shout out to iDoc. The conference was just last week. That was fun. I was in some of the doctor meetings or the owner meetings, and that was really cool to hear what people are doing, how they're adjusting. I think that's going to be important. Kind of listening to peers, seeing what's happening, keeping your feelers antenna out for what's going on, and looking outside the industry. So that's the biggest thing I would suggest is look outside the industry to see what trends are happening outside of healthcare, because eventually health it will come to healthcare, just not first.
Great. Yeah, that is a great point. Hey, Matt, always great having you come back. You'll be back again, one of our repeat guests here, and really appreciate your time, your insights, and how can people find out more about you and your company?
Yeah, mybcat.com. My business care team is mybcat for short. So mybcat.com. And you can also email me at ankit at mybcat.com or just connect with us on our website or social media platforms. So we're on all the major platforms as well.
Ankit, always a pleasure.
Yeah, absolutely, Steve. Thank you.
Thank you. Thanks, Ankit, and thanks everyone for listening. We'll see you in the next episode of I Own a Business.